Chapter 1, Introduction to Central Service. Minimally invasive procedures are modern surgical techniques where doctors use very small cuts and special instruments like cameras, lasers, or cannulas. Common examples include laparoscopic surgery for the abdomen, endoscopic surgery for the stomach and airway, arthroscopic surgery for the joints, and robotic surgery. Compared to traditional surgery, these procedures cause less pain, less bleeding, and small scars. Patients also recover much faster and return to normal life sooner. CSSD stands for Central Sterile Supply Department. It is the central area in the hospital where used instruments are properly processed and made sterile again. It follows a one-way flow system, starting from soiled instruments, then decontamination, clean area, and finally sterile storage. The main purpose is to prevent infection and ensure patient safety. In the decontamination area, all used instruments are received from different departments. This is the first and most important step of cleaning. Here, instruments are cleaned using manual and mechanical methods. Equipments like washer disinfectors, ultrasonic cleaners, cart washers, steam guns, and specialty washers are used to ensure proper cleaning. Safety is very important in CSSD. Cleaning and disinfecting agents must be used properly and contaminated items must be handled and disposed safely. Staff must wear personal protective equipment or PPE, including masks, gloves, gowns, eye protection, and shoe covers to prevent infection. It is also very important to separate clean and dirty areas and follow safety standards to ensure a safe and sterile environment. After instruments are cleaned and safe for handling, they are sent to the prep and pack area of CSSD. Here, each instrument is carefully inspected for cleanliness, proper function, and any damage. CS technicians must be skilled in identifying many surgical instruments and understanding how they work. They also assemble instrument sets, package them correctly, and label them before sterilization. Proper packaging is very important because it protects the sterility of instruments. CS staff must select the right packaging material and use correct wrapping techniques to ensure safe sterilization. Sterilization is the process used to destroy all microorganisms from medical instruments. Before sterilization, each item must be properly identified and processed according to the manufacturer's instructions for use, also called IFU. Sterilizer must be loaded correctly and operated using proper parameters to ensure effective sterilization. Quality assurance checks are very important and all records must be maintained for safety and tracking. It is also very important to protect sterile packaging from damage or contamination. Staff working in this area must wear proper attire like scrub suits and hair coverings and follow strict hygiene and safety practices. Sterile storage and distribution is the final area of CSSD where all sterile instruments and clean supplies are stored and distributed to different hospital departments. A separate area is used to remove items from shipping cartons to maintain cleanliness. The main focus of this area is the operating room, where most sterile supplies are required. A case card system is commonly used to deliver instruments safely. All surgical supplies are usually stored in a central location within CSSD, and a proper system is essential to ensure continuous and safe supply of sterile items. The processing cycle in CSSD is a continuous system where instruments move from use to decontamination, cleaning, preparation and packaging, sterilization, sterile storage, and then back to use again. At every step, instruments are carefully inspected to make sure they are clean, in good condition, and proper assembled. It is also very important that packaging is not damaged because any damage can affect sterility and patient safety. The case card system is commonly used in the operating room to prepare all needed instruments and supplies for one specific surgery. The case card contains everything required for that procedure. CS technicians use a pull sheet or pick list to collect the correct items. Doctors also have preference cards that shows their preferred instruments and setup for surgeries. The material management department helps manage and supply all hospital inventory and consumable items. Standard precautions are the basic infection prevention methods used in healthcare to reduce the spread of bloodborne pathogens and other infections. This includes wearing PPE, practicing hand hygiene, and safely handling blood and body fluids. These precautions are used for all patients regardless of their diagnosis. Healthcare associated infection is an infection that develops during a patient's stay in the hospital or healthcare facility and was not present at the time of admission. CS technicians require many important skills and knowledge to work safely and effectively. They must understand infection prevention, surgical instruments, communication, and computer system used in CSSD. They also need to follow safety guidelines, wear PPE, maintain confidentiality, and work professionally with the healthcare team. Good time management, problem solving, teamwork, and continuous learning are also essential. The main goal of every CS technician is to ensure patient safety through proper sterile processing practices.